The Center for Disease Control and Prevention states that roughly 12% of women aged between 15 and 44 years have difficulty getting pregnant and or carrying a pregnancy to term. Infertility is a very important issue with a growing global prevalence. With that being said, it is important that while patients are undergoing difficult treatment cycles to combat said infertility, they are receiving high quality, accurate, and efficient care. As all of us have been patients at some point, we know that it is imperative that we trust our providers are diligent in their efforts to provide accurate clinical results. I've worked in a fertility office solely running a Roche Cobas E411 machine that measures hormone levels in patients' blood samples for over a year. When using a Cobas E411 to measure hormone levels in patients' blood serum, there are a number of steps we must take to ensure results are accurate representations of the treatments they are undergoing. In order to ensure accurate patient results, we need to make sure the machine is calibrated correctly and passing quality control standards, that the blood we are receiving is labeled correctly and corresponds to orders for blood to be run on our machine, and that the results that come off the machine once it is done processing are accurate representations of the patient's treatment plan and are in the range we expect them to be based on previous results. First, let's talk about calibrations and quality control. Based on the Roche Operating Manual and the College of American Pathologists Pathology and Laboratory Quality Center, any machine used to process immunohistochemical assays needs to be calibrated and validated against a reference range before they can be used to analyze patient samples. Per the Roche Operator's Manual, every reagent pack on the machine needs a reagent calibration once weekly and a lot calibration once every 28 days, unless the lot number for the reagent pack changes when you put a new pack on, then it needs to be calibrated immediately. On this diagram, you can see that each reagent pack has a tab on the middle circle that corresponds to where it is on the reagent rotor in the middle of the machine. If you select the tab corresponding to each reagent, it will tell you when the next calibration is due. Further, quality control assays need to be run each morning on every reagent pack on the machine before testing patient samples. Once the results for this quality control are finished and print off, they need to be entered to the database that evaluates whether they are in range or not. If they're not in range, the line that corresponds to the reagent out of range will turn red, and the reagent needs calibrated whether it is due for a new one or not. It is important to note that with the database we use to evaluate quality control, as shown right here, it will make a result that is very close to being out of range show up as yellow. This is just a warning. However, if it is almost out of range again the next day, it will automatically change to red even if it technically still could pass. This situation will also warrant a new calibration. Now that we've talked about calibrations and quality control, we're going to talk about making sure patient samples are labeled and ordered correctly. The first step in processing actual patient's blood once the machine has been calibrated and passed quality control is ensuring patient specimens are labeled correctly once they are picked up from the phlebotomy lab. If the tube is missing a label, we need to throw it away and have the patient's blood drawn again. We cannot hope that the phlebotomist can guess who they have drawn accurately. The next important step to ensure accuracy is printing the right labels to put on the tubes that will be placed on the machine in the work list. Whenever you receive the blood from the lab where it is drawn, there are a couple of steps before it goes on the machine. The patient needs to be written down on their daily billing record, and 3 labels need to be printed. One goes on the work list while results will be written after they print off the machine. This work list also reflects what tests the patient needs run and the position on the disc shown on the previous slide on the machine. The other 2 labels go on 2 separate tubes. One tube will keep the leftover serum that is not run on the machine in case another test is ordered on a different day, and the third will go on the tube that is put on the machine so the barcode can be read. Once the blood is done in the centrifuge and you are pouring the serum off the top into the tubes, you have to be absolutely sure to pour the serum into the correct tube. If you don't, inaccurate results will print off on the machine for the patient. Next, we only run 5 of the more important to fertility treatment hormone tests on the Cobas E411 we are discussing today. These are estradiol, follicle-stimulating hormone, luteinizing hormone, progesterone, and human chorionic gonadotropin. That being said, it is imperative to check the patient's schedule block and the flow sheet that covers their treatment plan to make sure the orders in the system for the particular accession number on the patient's tube will accurately be run by our machine. If we put a label with the barcode for a test that we do not run on our machine, it will automatically stop it, alarm us, like previously shown, and prevent it from running any of the other tests that the machine may actually run. So if the patient's schedule block has prolactin, for example, along with estradiol and HCG, the machine will not be able to run it unless it is programmed manually. It's also important to make sure that the nurse or medical assistant who ordered the patient's blood order it correctly based on their flow sheet. All of the hormones we measure are menstrual cycle day dependent, so if someone ordered a cycle day 3 lab on cycle day 21, it needs to be corrected. Being proactive in processing patient results will help everyone involved in patient care as well as the patient themselves. Now that we've discussed calibrations and quality control and making sure patient samples are labeled and ordered correctly, let's discuss evaluating the patient's results based on their cycle and previous values. Even if you know your machine is calibrated and has passed quality control standards and the blood you received seemed to be labeled correctly and had correct orders in the computer that would process on your machine, there is still a chance that either the blood was labeled incorrectly before it left the phlebotomy lab for processing, or the patient's bodies are not responding to treatment as they should. It is important to review the results came off the machine to make sure they accurately reflect where the patient's value should be. It is especially important to review the medications that the patient's on and if their hormone levels are increasing accordingly. If not, either the patient just needs a different treatment plan because they aren't responding correctly, or there was a mix-up and the wrong results are going to be released for the physician's review. Then they could change or stop medication because the patient is responding poorly, when in reality they just need to be run again. In sum, tracking patients' hormone levels during fertility treatment is imperative to the success of the doctor's office. It's also important for the safety of the patients undergoing treatment and the efficacy of the prescriptions they are taking. When using a Cova C411 to measure hormone levels in patients' blood serum, there are a number of steps one must take to ensure results are accurate representations of the treatment they're undergoing. First, the operator needs to make sure the machine is ready for the day by running any calibrations and the required daily controls to ensure it's running accurately. Second, and throughout the day, the operator has to make sure the patient samples are labeled and ordered correctly. Finally, the operator must compare patient results to the flow sheet and make sure they accurately reflect where the patient's results should be. If they don't, they need to be investigated and run again. With diligent efforts towards ensuring accuracy on the Cova C411 machine, hormone results can be received and resulted quickly for patients that are undergoing fertility treatment. Releasing fast and accurate results can make a very difficult process a little bit easier for the patients and doctors involved. In doing so, we can give patients the families that they have always dreamt of, with little to no interruptions.